heart of the foundation is serving those people with special needs, and nothing touches us more than to deal with children who have those special needs.
You know, I really feel that we serve God best when you take care of the little children.
The Ayers Children's Medical Center is simply this. It's the bringing together of some of the world's best physicians to West Tennessee to treat some of the best children in the world, our very own.
It's a blessing to me to be able to help them. It's a blessing for them to be able to come.
Many opportunities come to us on a daily basis to change the lives of others. Some opportunities seem small or simple. Others are enormous. Together, their effects change the world in a positive way.
All that myself and my family want is after we're gone, the world is left just a little bit better place.
Because Jackson is centrally located between Memphis and Nashville, children used to have to travel hours for care. Because of a dream, help is now only minutes away.
These are children that have never known a day in their life that they feel healthy, that they feel good, in many instances that they haven't felt pain.
But there are parents who every day, day in and day out, they're dealing with those pressures and those stresses, and many times it's financial, and we're there to try to help those families.
Our mission is to provide the best care for all of the children, regardless of their circumstance, and then to educate their families and encourage them and to look forward with them to their children growing up to be strong and healthy.
To do the very best we can and provide the same good quality care for every child, regardless of whether their parents are rich or poor.
Before Morgan was born, I never would have thought we would have been faced with the things that we have faced. And it just changes your outlook on life, and it makes you want to do everything possible to make her life easier and the best that we can. We started bringing Morgan to the Ayers Medical Clinic when she was just a couple of weeks old. She has been diagnosed with a congenital heart defect, and she has numerous other medical problems. So the Ayers Clinic has just been a blessing to us because it allows us to be closer to home, and we don't have to miss as much work, and it's just been a blessing.
McKenna had, she was diagnosed with Down syndrome when she was 4 months into my pregnancy, and at age 3 months old she started seeing therapists.
Some babies have more than one problem, or their problems are interrelated, so they need to see a variety of specialists. And there again, if they had to travel out of town, they'd be going out of town 2 or 3 times a week.
Since we've got the Ayers Clinic, she's able to see a cardiologist, a urologist. She can also go to the Kiwanis Center for physical therapy. And just having the Ayers Center so close to home really means a lot to us and makes it a lot easier to deal with the issues that she has.
When the Ayers Medical Center started bringing in specialists for different needs, it's a relief.
I'm sure there are a lot of children who wouldn't receive the care if they had to go to Nashville. So just by virtue of that, we're saving lives and making their lives better.
Just to know that they're right around the corner from us, and the therapists open their doors like it's their own home. For us, it means a lot just to be this close. They get to know your children, they get to know the families and the needs of both.
A lot of our families don't have the resources to get back and forth to Nashville or to Memphis, and I even had one baby that I take care of. His mother didn't have bus fare, so she walked in December in 20-degree weather to our Ayers outpatient clinic to see a pediatric cardiologist.
The Ayers Medical Clinic has been such a blessing. It allows us to be closer to home, not get her out of her routine, and I'm just really thankful that we have that opportunity available to us.
McKenna's getting what she needs to be a productive young lady in society.
Our vision is that a child in West Tennessee never has to leave the Jackson area to receive any kind of specialized care.
I think that the need is great enough in Jackson that ultimately we could have a full children's hospital, the Ayers Pediatric Hospital at Jackson General.
From a practical standpoint, it needs to be here. You've got the resources here, you've got the physician community here, you've got the hospital here. This is where it needs to be.
It will give the West Tennessee area an opportunity to be able to be right at home when taking care of their children.
We're starting to develop a waiting list now, so that lets you know that we do need the services.
It will allow for health care for so many children across the West Tennessee area, as well as having it right here in Jackson. It's so accessible to our community.
It's something that is really more than just life-saving, it's life-changing.
We're blessed, not only to have McKenna, but have the therapy and the center that we need to have.
As business leaders, we need to support the foundation in all of its efforts to better our community for now and for the future.
If we don't do it, it won't be done.
Our vision is to continue the mission of the Ayers Children's Medical Center. We invite you to touch the lives of those in need, to give in any way you can. We invite you to become part of children's lives.